Hey, thanks for tuning in. I'm Nick Loffrey, bioenergetic health expert. I give this exercise a lot to people, so I thought I would finally make a video. This one is using a wall, so you need a flat wall without like paintings or anything on it that you can get your back up against for this one. It's used to stretch the back, stretch the spine, and help the posture. Often the thing that is most wrong with our posture is our proprioception, so that's our sensation of where our different body parts are in space. And that's the sensation our mind is giving us regardless of whether you're looking. So it's like being able to have your hand out here and know where the hand is without having to look at it. That's proprioception. So we have the same thing with our spine and the rest of our posture, where our shoulder blades are on our back, whether we have forward head posture or we're leaning back or leaning forward. Our body's sending us all this information, but sometimes it's just a little mixed up. So a wall is about the closest thing I could find to a flat wall out here in Joshua Tree Park. So I thought I would use this, but obviously better if you have a wall in your house. So this will just be a few minutes. You want to, if you have back pain, neck pain, things like that, this would be a really good one to practice pretty much every day for like a week or two and see if that improves things. If it doesn't improve things, maybe that's not the key for you, but I found for me this really helped my low back pain back when I had a lot of that. This is also really good if you're doing the Zhan Zhuang practice, the Qigong practice of standing meditation. These postures, maybe you're going through my little course with that. I'll put a link in the description if you want to try my Zhan Zhuang course, which is just on YouTube, free here. But even if you don't do any special Qigong stuff, this is just really good to help your posture, proprioception, and relieve pain. So what you're going to do, you're going to find yourself a wall. Now this wall isn't perfect. If it was, I would have my heels right up against the baseboards or against the wall. So that's what you want to do. Get your heels right up against it. I'm going to have mine a little away because this wall seems to dip back a bit. Then basically you're just going to get your tailbone against the wall, so don't put anything else against it, just the tailbone. And then try to roll your low back, lower spine against the wall, one vertebra at a time. And your ribs are going to hit the wall. You're going to roll the ribs onto the wall, the shoulder blades onto the wall. Your palms are going to turn forward. You're going to try to touch the wall with the back of your hands. And then you're going to bring your head back and try to touch the wall with the back of your head. And doing that in a way, not like this with your chin lifted, but with the chin tucked back. So it's almost as if you're trying to touch the wall with the whole back of your neck. But most people aren't going to be able to do that. But it's just kind of the direction you're trying to go. Get more and more close with the neck to the wall. So you can just hold here for a few seconds. You might feel already a little stretch along your back or your neck or somewhere in your shoulder blades. I usually get a little stretch in my upper left back area, right under the shoulder blade. And then we're going to try to hold this posture, not move out of the posture, but we're going to come off the wall. So the only joint that's going to change is your ankle. We're just going to bend a little bit at the ankle to come forward. And we're going to try to hold everything else exactly where it is. This might look a lot like a physical therapy thing. I actually learned it from a Qigong master. I guess they had this in ancient times. So this is the little Qigong variation. We try to hold it without the wall. And now we're going to try to get back to the wall. Every part of your back hitting the wall at the same time. So try to go back, maintaining the posture, just the ankles bending. And ideally, you see my hands came a lot forward. So ideally you try to train yourself to get everything touching at once. We're going to hold here again, try to stretch. Your tail, there's 3 points that should always be touching. Tailbone, upper back or the shoulder blades, and the back of the head. And then there's two areas, and the back of the hands. And there's 2 areas we're going to try to press against the wall. Think about pressing your low back into the wall. It's okay if it doesn't touch. Maybe your booty sticks out a little more and it's just too far to go back. It might never touch, but you're just kind of pushing in that direction. And the same thing with the neck. It might never touch the wall. You're going to keep tucking that chin back, lifting the crown of your head, pushing back with the back of the head, as though you were trying to touch the wall with the neck. Okay, then again, keeping the posture, try to hold it all. Shift a little forward just from the ankle joint. Try to hold the posture. You might maintain that feeling of a stretch somewhere in your back. I'm going to go back to the wall one more time. Tailbone, back of the head, shoulder blades, back of the hands, all touching. And then Really tucking the tailbone, sinking the chest a little bit to get the low back towards the wall. Tucking the chin, lifting the crown as though we're trying to get the neck against the wall. Hold here and stretch. A couple more breaths. And one more time. Try to come off the wall all together. Try to hold the posture steady. You're like a rock, except in your ankle. And last time, try to touch the wall with everything at once. Hold here, stretch one last time. Nice deep breath. And release. Get a little shake, you can roll your shoulders. Give your hips a little circle. Just kind of integrate that in. Other way. Good, very nice. So one of the things you're probably going to notice happens is when you try to go back to the wall, you're going to find one thing touches first. Like you might notice you've gone like this and now your tailbone's touching first. Or maybe you lean back and your head's touching first. And so that's going to tell you the difference between where your spine actually is in space and where you think it is. Because you might feel like, oh wow, I held this posture, I'm really upright. But really you're sort of retracting back into your baseline position, and your body's just telling your brain that it's straight. And so the wall will tell you, like, yeah, your head drifted back forward, so bring it back. And so that's the training. Physically stretching and opening and strengthening the body to hold that posture, and then also training the nerves to actually tell you if you're actually in it. So try using that every day, or ideally every day for a week or so, and see how that changes things. If you don't have time for that, doing it 2 or 3 times a week for a couple weeks should give you a lot of the benefit. You might do it before your workouts or after your Qigong or something like that, just as a little addition to throw in there. Okay, hope you enjoyed. Let me know if you have any questions in the comments. Remember to like the video, subscribe if you haven't already. Hit that little notification bell next to subscribe, and YouTube will actually tell you when I post new stuff, which really helps my channel and helps you find my stuff. All right, thanks everybody. See you soon.